A new non-invasive technique to pick up breast cancer has been unveiled by UK scientists. Breast cancer is the most diagnosed form of cancer in the UK. Current statistics show that there are around 11,500 breast cancer deaths every year, and that's 32 cases every day. Dense breast tissue, particularly common in young women, is difficult to image using existing techniques. Now scientists at the National Physical Laboratory have developed a new technique using ultrasound. I spoke to senior research scientist Daniel Sano to tell us more.
My research is a new ultrasound technique used to measure the properties of the breast for breast cancer diagnosis and risk stratification. Breast density is a risk factor amongst many other risk factors for breast cancer. Up until now, breast density has been this property that you would like to measure, but there hasn't been the imaging modality. You can do it at the moment with X-ray mammography. Women with high breast density have a reduced sensitivity to having breast cancer detected by mammography.
How does it work? How does the ultrasound interact with the breast tissue to give you an idea of the breast density?
Our technique emits ultrasound from one side of the breast, and we measure how much ultrasound is received on the other side. So you can sort of think about it as like an acoustic shadow. The amount of ultrasound that you get through on the other side is an indicator of the composition of the breast. Ultrasound is a simple technique. It could be quantitative in the way that we measure it, and it could be applied out of the clinic.
In your research, you also mentioned that this technique is still to be incorporated into a medical device. Do you have an idea of the type of medical device that we can expect to use this technique with?
Yeah, so research is early days. There's a number of things that have to be done for a technique like this to be incorporated and get it out into the clinic where it could be doing good for patients. The volunteers are positioned in a prone position, lying face down on a couch with the breast through an aperture into a vessel of water which contains the sensing and ultrasound equipment. That works very well as a research platform, but there are likely lots of changes you'd like to make to move from a research platform to a medical device. One of those is changing the configuration and potentially removing the water and having it directly coupled in a very similar manner to these handheld ultrasound devices. And because it doesn't use ionizing radiation, these scanners could be positioned out of a clinical setting and into institutions such as pharmacies for a very quick risk assessment.
Where to from here in terms of your detection technique? What would be the next steps?
We envisage that breast density assessment being done by ultrasound, this technique that is much safer to use, much more readily applied out of clinical settings. It could be done out of a hospital setting, which is really important. And our research is providing a path to that vision.